Hi, this is Diane, and welcome to DMD Digest. Today I'm going to talk to you about two different things, glucosamine and chondroitin. And you might be wondering, since my page here is in regard to digestion and digestive issues and problems and things that cause complications, you might be wondering, well, why are you talking about glucosamine and chondroitin? And there's a tie-in here. The main reason is because these are two very, very popular supplements that many people take. And I want to give some information about it, as well as get rid of some myths and things like that, so that you don't end up buying a faulty product or come out uninformed. And if you think about it, the idea for using glucosamine and chondroitin is to help with inflammation. So most people would think of using it for any kind of joint pain or any other type of related inflammation. So this ties into digestion, because we know that in digestive disorders, inflammation of the entire GI tract is the predominant symptom and the main reason why we have problems. So I would think that as a healthcare professional that glucosamine and chondroitin might help GI issues. So I researched it, and actually I found that it doesn't. I was incorrect. But I did find out some interesting information, and I want to share that with you. So what is glucosamine and chondroitin? There's a couple forms. There's glucosamine sulfate, which is the most popular that you're going to find in most of your supplements over the counter. And there's glucosamine hydrochloride. Hydrochloride, not as studied. It seems like it's not as effective as the sulfate. The idea is to take the two products together, glucosamine and chondroitin, and we have this in our that glucosamine helps to make our cartilage and our connective tissue that goes around our joints. And as you can see behind me in the slide, that's just it's a knee. And it's kind of showing you the stages of no arthritic damage to progressive arthritic damage. And predominantly it's talking about osteoarthritis. Most of us at some point will end up with osteoarthritis, especially if you play sports or you're active, or even just clicking a mouse all the time, dealing with your laptop, sometimes just every day in and out, dealing with groceries, lifting bags, our purses, things like that. Eventually we're doing damage, wear and tear on your joints. So with that in mind, looking at products out there. Now, if you've listened to any of the other things I've ever said on any of these other webcast programs, you'll know that it's really important to do your research about your product and make sure that they're USP certified. And if you want to research it even further using consumer labs or verified research, you can go online and Google that and look at products that are better studied, and have a little bit more information and solid research behind it. So if we're looking at, well, how much of it should I take? Glucosamine sulfate for adults is usually 1,500 milligrams a day. If you're a child or 100 pounds or lighter, it's generally around 1,000 milligrams a day. For chondroitin, looking at around 1,200 milligrams a day. If you're a child or under 100 pounds, 800 milligrams a day. Another alternative, and the whole idea would be to consider using this in lieu of like ibuprofen, which would be your Motrin, Advils, or Aleve over the counter, which is naproxen. So it's just a different alternative to use in place of that. And on that note, one of the reasons to consider glucosamine and chondroitin instead of the ibuprofens and things like that out there on the market is because if you have GI issues resulting in any kind of digestive problem or heartburn problems, anything like that, there's actually been quite a bit of research tied to the use of ibuprofen products and like Aleve, the naproxen, to causing more GI problems, more problems with your intestines, more problems with acidity in your stomach, to be able to break down the food which you're eating. So people that have a lot of joint pain, arthritic pain, any sports injuries, things like that, if you're loading up on ibuprofen products, you're likely going to be at some point causing some GI problems. So an alternative, glucosamine and chondroitin. Now there's been a lot of different studies done with this and people talking about, its use in all kinds of things, rheumatoid arthritis, and should you take it to postpone having like a knee surgery or hip surgery or ankle, elbow. Does it do anything if you have diabetes? Does it help with Alzheimer's? You name it. Just like any other product out there, it seems like a little bit goes in crazy directions and people take an idea and then try to apply it to every part of your body and say, oh yeah, hey, buy my product and it's going to fix everything. Well, the research shows otherwise. Basically, it is most likely and has the most probability for only benefiting osteoarthritis. Everything else, it's possible that it could be helpful, but the research doesn't really show that. So don't waste your money on that. If you're looking at, should I start loading up on these supplements to prevent a knee surgery? I don't know that I would say loading up, but the general consensus is if you're using both of the supplements together for 2 months or longer and you have not noticed any improvement, for one, I would reevaluate the product that you're using and make sure that it's a good one. The other side of it would be if it's really not doing anything, you feel confident about your product, you've discussed the use with your doctor or advanced practice individual, then it's probably not going to help. You probably need to stop it. Things to look for that if you don't even get that far, things to look for possible side effects or reasons why it's just not a good idea to take it maybe at all. Unfortunately, just kind of like everything else out there, both of these supplements can cause stomach problems. So you're saying, okay, well, why would I waste my money on these two supplements when you just told me that if I go take 800 milligrams of Advil or Motrin, and I take it 4 times a day, and I've been taking it for the past 2, 3, 4 months, that can eat up my stomach too. And now you're telling me that these two supplements can do the same thing. Yes, that's what I'm telling you. That's possible. I want to talk about two medical conditions that I would be very cautious with in using glucosamine, whether it's sulfate or the hydrochloride. But remember, the hydrochloride has not been studied very much, and there really doesn't seem to be as much efficacy. So if you are diabetic or on any blood sugar medication, such insulin definitely, but even metformin, glipizide, those products, you want to be cautious with your use of glucosamine. I would definitely discuss it with your healthcare provider and find out what their thoughts and feelings are, because glucosamine can interfere with how the insulin reacts, and it can alter your blood sugar levels, and that could be detrimental if you're diabetic. Another thing to consider is the use of chondroitin. Chondroitin isn't necessarily going to interfere with blood sugar. However, chondroitin would be really important for a couple things. If you are on a blood thinner, such as Coumadin, also known as warfarin, Xarelto, Eliquis, any of those blood thinners out there, you would not want to use the chondroitin. Also, if you're going into a surgery, you know how they always tell you, stop certain medications. You would definitely want to run that by your healthcare provider as well, because the chondroitin, along with your blood thinners, can actually thin your blood out even more and create more problems. So those are two things that I would definitely steer clear of. And one of the reasons why I'm sharing this with you is because many healthcare professionals aren't really even asking their patients, you know, do you take herbs? Do you take supplements? Do you take vitamins? Do you use any type of alternative, you know, medicine? So this is important. I think in this day and age, there are more of us that are looking at alternative ways to manage our symptoms. And in this episode today, we're talking a lot about joint pain and what do we do with it. So just to be conscientious, again, always run things by your healthcare provider. Look at your product, know your product, research your product. Make sure you are knowledgeable. Don't buy something that's filled with fillers and crap that's going to do nothing. And basically, if you're looking at the glucosamine and chondroitin, consider it for osteoarthritis predominantly, not too much anything else. Thank you so much for your time. It was a pleasure talking to you.